Healthcare coverage, facts and myths. The healthcare system in the United States can be confusing in general, and how healthcare coverage works can be even more difficult to understand. Today we're going to explore some common beliefs about our healthcare system and clear up some misunderstandings. We'll look at how people get their insurance, what coverage means, and how the U.S. compares to other countries. Let's explore some facts and myths about healthcare in America. Most people in the U.S. get their health insurance through their employer. The 2022 census found that about 54% of Americans are covered this way. Additionally, 37% are on government plans like Medicare or Medicaid, and 10% use the marketplace set up by the Affordable Care Act. In Kentucky, the marketplace is known as Connect. Interestingly, and contrary to popular belief, did you know that the U.S. actually does not have one of the best healthcare systems in the world? It's a myth. According to the Commonwealth Fund's 2021 report, when compared with 10 other high-income countries such as Australia, Canada, and the UK, the U.S. ranks the worst on measures of healthcare system performance. Now, let's bust another common myth, that your insurance will begin as soon as you sign up or start a new job that provides healthcare coverage benefits. In reality, employers can have a waiting period of 30 to 90 days before new employees are eligible for coverage. So, if you're starting a new job, check the waiting period for health insurance benefits. If you get coverage through the marketplace, the open enrollment period happens from November 1st to January 15th, with coverage starting January 1st if you sign up before December 15th, or February 1st if you sign up after December 15th. If you sign up during a marketplace special enrollment period, coverage will usually start on the first of the following month, but this may vary depending on circumstances. The idea that anyone who wants it can get care is partly true and partly untrue. While emergency rooms are required to see anyone who shows up at their doors, the uninsured or underinsured often delay care due to concern about cost. When they do get care, the resulting medical bills can cause financial hardship. Medical costs or time off work due to illness are the leading cause of bankruptcies in the U.S. Here's a tricky one. If you have health insurance, do you always have access to care when and where you need it? Not necessarily. Out-of-pocket costs, such as copays or deductibles, can be a barrier to care. Some insurance plans, such as HMOs, only cover in-network providers, except for emergencies. Other barriers include shortages of doctors and other healthcare providers, especially in rural areas, not enough doctors accepting your type of healthcare coverage, practices closed to new patients, or challenges getting to the provider, such as not having adequate transportation or childcare. And what if your doctor recommends a procedure? It's a myth that your insurance will automatically cover recommended care. Often, your insurance plan has to approve the procedure. If it's denied, you'll have to pay the full cost if you opt to proceed. One of the common arguments against universal health care is that you would have to wait longer to see a doctor. That's a misleading objection. Even now, patients in the U.S. can wait months for appointments, especially for certain types of specialists. It can be difficult to find a doctor who takes new Medicare patients. It is far from clear that giving everyone access to basic care would increase wait times. In fact, there's good reason to believe that by improving the ability for people to get preventive and routine care, emergency visits may go down and the health of the population as a whole will improve. Another myth is that universal health care would be too expensive. Despite spending a fortune on health care, many people in the U.S. still can't afford the care they need. Other high-income countries spend less per person, yet their people live longer and healthier lives. Universal health care could reduce overall spending and ensure everyone gets necessary care. Another fact about health care coverage: the Affordable Care Act requires coverage for preventive care like well-woman exams and screening mammograms without copays or deductibles. However, this is currently being challenged in court, which could make it harder for people to afford these types of services, thereby causing delays in diagnosis for everything from cervical and breast cancer to hypertension and diabetes. Finally, it's a myth that rich people have no trouble affording health care. Even high-income families sometimes avoid or skip medical care because of costs. In Kentucky, for example, a significant percentage of households with incomes over $100,000 avoid care due to high costs. Healthcare in the U.S. is complex. Separating facts from myths can help us navigate the system better and advocate for changes that will improve our health and lower our costs.